and I will introduce Dr. Braun. So the fabulous Dr. Beth Braun is a wellness expert specializing in diabetes management, nutrition, and behavior modification for over 20 years. In her private practice, Dr. Braun works with adults and children faced with diabetes, burnout, anxiety, and depression. Dr. Braun has had type 1 diabetes for 42 years and knew since she was a teenager that she wanted to help people with the emotional challenges of diabetes. In the past 2 years, she was one of the first people trained by both the ADA and JDRF in their new mental health programs connecting the emotional aspect to diabetes care. And with that, take it away, Dr. Braun.
Thank you for that beautiful introduction. Good evening or good afternoon, depending where you're watching from. Like Laura said, I am Dr. Beth, as they like to call me, and I've actually been type 1 45 years now. I hit my 45-year anniversary in April, and it's just been fantastic, wonderful. Woo! When I started, these were big technology. Disposable syringes, because back in the early 70s, we would boil glass syringes. And other big technology was getting your own home blood sugar tester. And now look where we are, closed loop systems, which I have and I love. And we've come so far with our CGMs and technology, and I'm so grateful for that. So let's talk mental health tools for diabetes, because if you don't think mental health is important with type 1 diabetes, I don't know what you think is besides insulin. Let's go. Okay, be your biggest cheerleader, not your critic. And here's a picture of me from my cheerleading days. Kidding, just seeing who's listening. Yes, those are my abs. Be your biggest cheerleader. It is so easy to put yourself down. It is so easy to criticize yourself. Strive for perfection. Strive for those days that are 80, 90, 100% in range, and not think that you're doing such a good job when you are. No matter when you're trying, you are doing a good job. Realize the importance of mental health and diabetes with your thinking. Then when our numbers are out of range, we're not thinking clearly. And the high sugars and the low sugars have such an impact on our intellectual thinking. And we're going to talk a little about this. Diabetes is not a contest, okay? You are not competing against everybody else here at Connected in Motion or everyone else with your doctor, or you're not even competing with yourself. What you are doing is trying your best. If you don't achieve your goals, if you have a week that was a tough one with stress, with numbers, being out of range, you're not a failure. You didn't screw up. If you forgot to bolus or take your insulin at dinner tonight, that doesn't make you a bad person. And so many times we feel terrible. How could I forget? How could I forget? Someone in the family yells at us, how could you ever forget that? How could you be so stupid? No, it was a simple mistake. Stop being so hard on yourself. Okay, and back to my cheerleading days. Who else is in your cheerleading squad? You think about the pyramid those cheerleaders make. The widest part is the bottom, and that's the support, that's the strength. So who else is cheering you on? Is it your endocrinologist? Is it your diabetic educator? Is it someone in your family, your kids, or your parents, or spouse, sibling, friends, other people in the diabetes community? Who else really just tells you, good job, and I know how hard you're trying? I don't think we hear that often enough, and you have to decide, where do I give out the pom-poms? Who else is on my squad? So diabetes plays a huge role in mental health. Okay, I know, I've said this several times now, But we don't pay attention to that. Not enough, as it's going on constantly. People with type 1 diabetes have a higher risk for depression, diabetes distress, anxiety, and disordered eating. So with type 1, you're 4 times more likely to be dealing with depression. Look at what we're up against. And then diabetes distress, burnout, anxiety. There's a huge amount of anxiety dealing with the day-to-day of diabetes. Did I remember this? Did I do this? And then the anxious, overwhelming feeling when you have a low blood sugar, or when you have a high blood sugar and you can't get it down. Many people describe to me, and I would use the word, feel anxious. When you go low, your mind and body goes into this feeling of, I have to survive. And the anxiety can stay until your numbers come back up. Disordered eating. There are many times in life that people are saying, should you be eating that? Or you can't eat that, you have diabetes. And binge eating disorder is very common with diabetes. Same with closet eating and people using high blood sugars as a way to lose weight. You are constantly monitoring how many carbohydrates you put in and how many calories. You can become OCD about your thinking on food. And it's important to pay attention and reach out when you think this is an issue. In my opinion, maintaining mental health is as important as working on physical health. Awareness of your emotions is key. So let's talk about depression for a minute. I'm sorry if I'm repeating myself if you were in my last talk. But symptoms of depression can vary from fatigue to overwhelming sadness. I just can't stop crying or cry every day. Loss of interest in activities you used to enjoy is also a symptom. Now here's my catch-22. High blood sugars can cause depression, and depression can increase high blood sugars. What happens when we're having higher or lower blood sugars is the part of our brain that regulates emotion isn't working as quickly. So if you notice, you are quicker to react, you're quicker to yell or jump or cry when our sugars are out of range, and that's because our brain isn't working as quickly. This is a normal response for brains when they're trying to put you in survival mode. It's key that you don't be afraid to ask for help. Depression or anxiety is nothing to be ashamed of. It has such a stigma and it shouldn't. Well, there is therapy, support groups, exercise helps so much, going outside on a beautiful day, even just taking a walk, reaching out, medications. Okay, number 2 in my 5 tools, stress management. So I want everyone right now to take a deep breath, a cleansing deep breath. We've been going all day. We got a pandemic going on. America has protests everywhere. Let's focus for a minute and let's take home a tool from my talk. First one is progressive relaxation. I want everyone to sit and close their eyes. And I want you to squeeze your shoulders as tightly as possible so you feel like your ears and your shoulders are attached, and release. Tense them again, squeeze them, and release. Now, I can't see you. We can't see you. Your cameras are off. So I want everyone to do this with their face and their foreheads and their cheeks and their mouth. Tense it and release. Tense it again. Now notice the difference from a couple seconds ago, from before we tensed it and released it and after. The whole point of the progressive relaxation is to become aware when you're holding stress. You can do this throughout your body, your hands, your arms, your legs, and your whole body, and think of it as a sponge and you're squeezing out stress. Often when I'm doing progressive relaxation with patients, I like to add in guided imagery. You're lying somewhere beautiful. You're somewhere safe and warm, and think about the nature out there. Another great stress management tool is yoga, breathing exercises, pranayama. Now, I know there was yoga in here today. Pranayama is an entire way of breathing in the yoga world, and it makes you very aware of the stress and the calmness that can take over your body. Slows down your entire nervous system, and for all of us, our nervous systems are in overdrive. Stress management is key in calming down the nervous system. Okay, my favorite stress management tool is being out in nature. Journaling, walking or other physical activity, and very, very ancient Chinese medicine brought Tai Chi and Qi Dong, which are ways to center the self. And there's some wonderful classes on this that really help reduce physical issues from stress. How do you know if you're stressed out? Well, the easiest way to know you're stressed out is your blood sugars run high. Why does this happen? I'm often asked, Dr. Beth, why do my blood sugars always go high before I have a final exam? Or why do my sugars always go high before I go on a date? Stress is key to bringing on the fight or flight response. So the fight or flight response releases cortisol. It's the whole body ready to move and take off and go. And cortisol's released, adrenaline's released, glucose is released from the liver. What does glucose do? Bring up the sugars. Stress management helps stop the fight or flight response. It helps you manage that. Okay. How else would you recognize stress? Muscle tension, which we addressed in progressive relaxation, especially in your lower back, your jaw, your neck, your shoulders. A lot of people with anxiety and stress have digestive issues, stomach aches, and headaches. How about irritability? Oh yeah. Feeling completely worn out and drained. Your body is in fight or flight response all day long, or even for a short period. It's exhausting physically, and it wants to rest. After all of these hormones like adrenaline and cortisol are released, we become tired. Another key sign that many of us are seeing during the pandemic is trouble sleeping. Okay, this is a biggie. Awareness that blood sugars affect your mood or personality. How many of you guys are aware that blood sugars can play a role in your bitchiness? I really had no idea until about 6 years ago when an old boyfriend of mine who was also a doctor mentioned to me, when my numbers are above 200, I can get a little bitchy. And then I started paying attention to it and becoming aware of my attitude. And I can tell in the day when I become irritable, like laying on the horn when I'm driving, or too quick to snap at people in the supermarket. I look down at my monitor and you betcha I'm above 200. So pay attention to your arguments and irritable moods. Do they occur when your numbers are above range or below range? Lucky for me, I don't get too bitchy when I'm below range, but above range, yes. And this is one thing people are not aware of. I work with so many couples where the person, one of the people have type 1, and he or she isn't aware that their personality changes. And again, that goes back to our sugar is out of whack. If our numbers are out of whack, we are not capable of fully controlling our emotional response. Know when to take a mental health break rather than starting a huge argument. I like to call it go back to your corner. So if a coworker comes in and you're 320 and you just want to snap at him or her, know when to say, hey, wait, let's circle back to this. Or you snap at your roommate or your girlfriend. Know when you can say, hey, I'm out of range right now. My numbers are high. Can we talk about this in an hour or so? Let them know you're not thinking clearly and they're not going to get the best side of you. If it's at work and you have to respond quickly, just watch yourself. Be aware of what you're saying and what you're sharing and what part of yourself you're putting out there, because we don't want people thinking you're using diabetes as an excuse. Okay, back to our cheerleading squad. Build your emotional support team. I'm sorry, but if you don't have people behind you, friends, family, they want to help, but you need to let them know how they can help. Is it going to the market for you? Is it preparing healthier foods? Is it not bringing cookies into the house or Ben and Jerry? What helps? And then what kind of comments trigger you? Like, are you sure you should be eating that? Is my least favorite comment. The other comments that trigger you, be aware of and ask the person to reword that or show them. Communicate your needs. Find as many friends as possible with type 1 or a support group for type 1s, because nobody can understand what a high or a low or a bad infusion set or forgetting your test strips feels like. And the more you can talk about it and the more you have people to relate to you, the easier time you will have. Okay, and last, having a good relationship with your endocrinologist or your diabetic educator is key. You don't want to fear them. You want to have people in your life that understand you. You want to have people that you can lean on and say, hey, I'm going to Hawaii in a couple weeks and I don't know what to do about my insulin pump. Can I take a pump break? Or I'm going to Italy and I want to eat everything. I don't want to be held back on pasta. What can I do dosage-wise? So you can be your authentic self with these people because they are a part of your cheerleading squad if you're with the right ones. If you don't feel comfortable being completely real with your doctor or your diabetic educator, ask others for someone they like, because this is, besides your spouse or your boyfriend or girlfriend and other immediate family, I think it's one of the most important relationships you will have. So be aware of that and don't be ashamed of things you're doing when you're talking to them. Okay, I hope some of you giggled when you saw all of those bags. Being prepared can reduce anxiety, stress, and diabetes drama. Diabetes drama, I made that term up, but we all know it. So many of us, especially in the States, get our pump supplies from one company, our Dexcom or our Libre supplies from another company, the insulin from a third pharmacy, and then all of our other medications and supplies from yet another place. It gets overwhelming. It gets confusing. And then if you have children in the house and you have to get them things, Make a time, make a date in your calendar, maybe the 5th of the month or the 1st of the month, to look and check on your supplies. Set a reminder on your calendar. It's so easy. And look, oh, where am I with pump supplies? Because if you get to the last pump supplies and then you call them, hi, I'm on my last infusion set, and you're anxious waiting for it, first of all, your numbers are going to go up, but you want to just be on top of it. Okay, keep extra supplies where you can. Right now we're in strange times. We're not running to the office and the gym and the car, but in more normal times, keep supplies there. Extra glucose tablets, extra test strips, extra low blood sugar snacks, extra infusion sets for your pump. The same is true when you travel. We will be traveling again soon. And my mom used to laugh at me because when I would pack, I would have all these bags and it was all my accoutrements for my diabetes, especially when you're on a pump. It may take up a little room. You may feel foolish bringing extra, but what happens if you're on a mountaintop somewhere in Italy and your pump breaks out and you only have one more infusion set? It's not safe, and that is exactly what we call diabetes drama. Emergencies and technical difficulties happen. We all know that. Technical difficulties such as the pump stops working. Okay, well, let's hope you have a backup pen with you or a backup vial of insulin. You know, it's one thing if you're down the street at a restaurant, but if you go an hour away from home or you're at a concert and you don't want to have to come home, have it with you. Make it part of your little kit that you keep with you. Have backup. You keep calm. It's very important to know where you're going and what you need for that amount of time. It makes a difference in remaining calm and being able to focus on what's important. So diabetes looks and acts differently with all of us. What works for one person may not have the same results for another. But the one thing that does work for all of us is gratitude. So easy to get caught up in why me, and I can't believe I have to do this, and can't believe how much diabetes I have, and I'm the most unlucky person. Often I'll look around at a family event at 100 people or so at the event, and I'm like, how am I the only fool here with type 1? But make the lemonade out of the lemons. Be grateful for what you do have. Be grateful for the technology that's come through today. If you had diabetes 101 years ago, you'd be screwed. There was no insulin 101 years ago. We didn't have CGMs 10, 15 years ago. We didn't have pumps 50 years ago. Life is so different. And those of you that are newer diabetics don't realize you came into this world with all the technology. But for me, you know, we did urine testing. Be grateful for your health. Be grateful for what you do have, the roof over your head and everything that you do have. If you show gratitude for, it's the #1 way to help with depression. It's the #1 way to help with anxiety after stress management. Gratitude helps stabilize you. All right, guys, thank you so much for joining me. I want to leave time for questions.
Yes, Dr. Beth, thank you so much. That was awesome. We have a very good question that came in before us. So how do you change those ingrained thinking patterns around being a failure? I am a perfectionist and experienced burnout last year as I just felt like a total failure. It's so hard to refrain those thinking patterns.
Well, like we talked about in my burnout talk, setting small goals. So you're getting stuck and you feel like you run hot, your numbers run too high. So you want to reach out to your medical team and see what else you can do. But if you know each and every day you're trying the best you can and you made an effort, then I want you to try putting your head on the pillow and thinking all that you did accomplish that day. And it's easier to feel less like a failure. It's easier to feel accomplished when you keep track of your goals. Make a chart, make a checklist each time you reach a goal. I hope that helps.
Awesome, thank you. I'm just waiting to see if anyone has any other questions, but in the meantime, I also will put the link to the post-session survey in the chat. If everyone could fill that out, we really appreciate it. And I also want to remind everyone of the social session that's starting at 7 p.m. There'll be a concert, lots of fun, and we hope to see everyone there. And it doesn't look like we have any outstanding questions, so I also want to thank everyone for coming, and thank you, Dr. Beth, for another awesome session.
Thank you.
And we also put Dr. Beth's contact info in the chat for anyone who's looking for that. So thank you so much.
Thanks for coming, everyone.